regulated and subsidised by the Commonwealth unsafe. Joining us live now from Melbourne is federal Victorian Liberal MP Tim Wilson. Tim Wilson, thank you for your time. What did you make of Daniel Andrews' comments yesterday?
Well, I think the focus clearly from the Commonwealth as well as the state should be on the shared responsibility to address and solve this crisis rather than throwing around blame. What we know is the Commonwealth gave advice to the state government early in the piece last week around the need to make sure that elective surgery was cancelled to support people in aged care if required. Now, I'll leave it to the state to decide to answer why they chose not to do so. But what the Commonwealth has been doing regardless is continuing to back up its focus on supporting people with aged care with access to PPE, access to surgical and ordinary face masks, access to individual case managers, so that if there is a problem in an aged care facility around the country, and particularly in Victoria this time, that people are getting the support that they need.
Daniel Andrews is correct, though, in saying that aged care homes are regulated and subsidised by the Commonwealth, isn't he?
It's absolutely true that that's the constitutional framework in which we operate. But there's also a shared responsibility about how these systems operate with each other, which is why the Chief Medical Officer had to give counsel and advice to the Victorian State Government to close down elective surgery to provide support for aged care residents. And that's why the Commonwealth is providing all of that access to critical support services to aged care and has been doing so now for many months, since March, so that people get the support and assistance they need. Now is the time to make sure that we're putting, and we heard earlier, some tragic stories of children of aged care residents, sadly, who passed away, who need support, and that's where our focus must be.
We've had the workers' union that represents those aged care workers on this morning saying that the federal government's sending cough in your elbow, Tim Wilson, saying that you need to get the PPE into these aged care homes, but you also need to make sure that it's actually getting onto the staff members that need it the most, that it's being locked away in some residential homes. Is that going to be enough of a support to stop these spreads continuing?
Well, we've actually provided support and training for more than 100,000 aged care support staff so that we can make sure they're in a position to understand exactly what it is they need to provide a support and assistance to aged care residents, and ultimately to raise these issues directly with the management of aged care homes if that's not being fulfilled. That's why, I keep going on about it, but that's why the extra masks have been released from the national stockpile to support aged care, and that's why we've made sure that staff on the ground have the training to know what they need to deal with containing any outbreak and supporting those people who may face an infection. By doing so, we're dealing with at each end of the cycle to provide the support and assistance they need in those critical environments where there are risks associated with the spread of the virus, and of course amongst some of the people who are most vulnerable to the risks of coronavirus because of their age and health conditions.
Now, one of the issues that we've seen highlighted is the fact that these infections are getting into aged care homes because of the community spread in Victoria. Do you think enough is being done now, especially in the space of contact tracing, to stop this community spread?
Well, we're all both learning as we're going, but also identifying new problems as they come along. Now, there's currently inquiry at the state level to look into exactly these types of issues about whether enough focus was put on community transmission to stop transmission between the community and aged care homes. There's obviously issues around staff and whether they're taking full responsibility for their circumstances. What we have to do is make sure we're getting or taking the measures necessary to support the people who are supporting others who are facing infections, and so that we don't see new outbreaks. That carries a responsibility on all parties on behalf of aged care providers in the community sector, the for-profit sector, and of course for other providers, of course the state government and the support services that they provide to make sure that we're getting the help where it's needed.
Just on a bit of a broader topic, what's it like down in Victoria at the moment? I know we're all talking about it from afar, but it seems like a lot of people in Victoria right now are really doing it tough.
Well, the reality is even for those people who aren't infected with COVID-19 and who are trying to get as best around their ordinary life, it's frankly pretty flat. And a lot of people tell me regularly they're flat. They're not in their usual spirits. Obviously, it comes at a difficult time of year because it's winter anyway. I think people are struggling a bit. We did a forum last night on our Facebook page on mental health with local mental health support providers, so that if people need assistance and guidance about how to manage their circumstances, that they should get that support and assistance. Because we're finding amongst a lot of young people who find themselves out of work or not able to go to university, clearly not to engage with their friends, that it's quite a withdrawal from usual life. But that's no different for people working. So behind the COVID curtain, I've got to say, the rest of Australia doesn't want to be where we are.
No, not at all. But our thoughts are with you. I know the people I've been speaking with in Melbourne have been finding this lockdown much harder than the first one. So our thoughts are with you. It's no small issue, the mental health approach. Tim Wilson, as always, thank you for your time. Sorry to give you a hard time about your coughing technique. It's just an important topic these days.
Of course. Thank you.